With our second phase of reopening starting today, there are still precautions we all need to keep in mind. Joining us to talk more about that is Dr. Henry Anyimadu, Infectious Diseases Consultant with Hartford Healthcare's Hospital of Central Connecticut. Doctor, thanks for being with us.
Thank you for having me.
So with the second wave of the state reopening today, what is your advice to people as they begin to venture out to places like gyms or indoor dining?
I think we should all remember that the virus is still circulating in the community. And the only reason why we are seeing the numbers going down is because of our collective effort. Our collective effort at physical distancing, using enhanced hygiene techniques, and masking. We shouldn't let go of all these techniques that we've learned over the past 4 to 5 months. We should reopen carefully in a rational fashion so we can continue to interrupt the spread of this virus.
And doctor, now that we're into this second phase, people might be thinking, do I still need to wear a mask when I'm out in public? How do you answer that?
I think we all need to continue wearing masks in public spaces, especially in situations where we can't keep 6 feet from other people. There's a study that was published in The Lancet that showed that face masks actually decreased the risk of infection from 17.4% to 3.1%. So it still has a place in preventing the spread of this infection. So we should continue to wear masks.
Okay, so people are going to start venturing out more. The numbers of people you can attend a party with safely, these things are all probably going to start happening a lot. Do you think the numbers will start heading back up as people get out more?
It is concerning because as people get out more, interact more with people, there is the possibility that we could see another spike in cases. But the good news is now we know how to prevent this disease. We've had it around for 6 months. We know that wearing masks, physical distancing will all prevent the transmission of this infection. So I'm hoping that we probably wouldn't have spikes, but it's very possible as we reopen.
And doctor, let's talk about the elderly or those with underlying conditions. What is your advice for them? Is it safe for them to venture out?
You know, as the governor said, those that are 65 years and older should still try to stay home as much as possible, and especially those with comorbid conditions like hypertension, coronary artery disease, heart disease, and they should try and stay home. And I believe that we all have a responsibility to protect the most vulnerable amongst us. We should all behave as though we have the virus. And when we are around the vulnerable people, we should try and wear masks and distance ourselves as much as we can.
And doctor, one more quick question. What are your thoughts for people to get tested?
I think testing is widely available now, and we have the capacity to do a lot more testing. So people should go out there and get tested. If you feel that you have symptoms or you're not well, you should quickly go to any of the Hartford Healthcare centers to get tested. The good thing is you don't even need an order from a physician. You can just walk in or drive in and get tested.
All right, Dr. Henry Anyimadu, thank you very much for joining us today. Great information.
Thank you for having me.